Hello, good afternoon or good morning, depending on where you are. We'll give it a couple minutes before we go ahead and get started as folks are logging on. Right, go ahead and get us started. I know folks are still joining, but we have a lot of great content today that we're excited to get to. So thank you so much for being with us here today, and welcome to our webinar on resolving encampments with outreach, services, and housing. We have a lot to learn from the amazing panelists who are joining us today. So I'm just going to kick us off by sharing a little bit about what motivated this work and what you can expect from the webinar before we dive right into the content. My name is Nicole Dubois. I'm a senior research analyst and coordinator at the National Alliance to End Homelessness. In this role, I've had the pleasure of working with teams of researchers through our Research into Action initiative. The Alliance's goal with this project is to generate evidence that helps improve service delivery and shape smart public policy, particularly in the areas of responding to unsheltered homelessness and improving the effectiveness of permanent supportive housing. This webinar is the third in our Research into Action series, and in a little bit, I'll drop a link to our website where you can learn more about this project. The research project that you will hear about today was completed by a team at Homebase. They studied different encampment resolution approaches in 4 California counties. In their work, we learned directly from encampment residents about how they experience these efforts and how service providers and system leaders can continue to strengthen their approach to serving people who are unsheltered by listening to what they say that their needs are and partnering with them to design better programs. Homebase's research is so important because it offers us person-centered approaches to encampment resolution that prioritize outreach, service delivery, and pathways to housing. In each community, one theme that stood out again and again was the central importance of street outreach staff who provide vital services to people residing in encampments. This is our agenda today. I'm soon going to turn over the floor to Esther and Will, who will tell you about their project and some key takeaways. Their presentation will be followed by a panel discussion with Kimberly from Los Angeles County Homeless Services and Housing and Josh from the city of Berkeley, who worked with Homebase during their research project and can share more about what this work looks like on the ground. The conversation will be moderated by my great colleague, Alex, the Alliance's Senior California Policy Fellow. And it will include questions from the audience, so please, as you think of them, drop them into the Q&A box. I'll now invite Will and Esther to come on camera and share their screen. We
Am
can
I
see it.
start?
Go
Are you
for it.
going? I go, you go. Perfect.
Thanks so much for the introduction, Nicole. Hello, we're from Homebase, and we're here to present our research today. The title of our research is In Their Own Words, Californians' Journeys from Encampments to Housing. And you're going to see a lot of illustrations today done by our amazing colleague, Shabani Rao, including these great comics that are here right now. So I'm here with my colleague, Esther Wilch, who's a directing attorney at Homebase. My name is Will Early. I'm a senior data analyst, so doing some of the quantitative support for this project.
Cool. Thanks, everyone. We're excited to be here. We have a lot to get through today. I'm just going to briefly set the stage for what you can expect over the next hour. Will's going to give you a little bit of background on the context in which the study took place and why we thought it was an important thing to look at in this moment in time. Then I'm going to spend a minute introducing you to our research questions and the methodology we used before giving you a very high-level overview of our qualitative findings. And Will's then going to give you a similarly abbreviated description of our quantitative findings. We'll provide a quick conclusion, and then we're going to launch into that panel with Josh and Kimberly. And with that, I will pass it to you, Will.
So just to provide a bit of background of this research project, if you're somebody who a QR code works well for you, there's a QR code on the screen. Go ahead and scan that. Esther is also going to put our link in the chat that will link you to the full report that goes very in depth about everything we're going to talk about today. We also created an accompanying web-based version of the report. So it's a little more approachable. It's a little shorter. So if that's something that might work better for you than the longer PDF format, that might be a good option. So go ahead and check that out. They're both in the link this QR code will bring you to, but also that Esther will put in the chat. So big picture, kind of like, why is this research important? Well, we know that criminalization is growing across the country, and urgent solutions are really needed to help communities address their unsheltered homelessness. And so communities are responding. They're doing what they do. They're implementing policies and taking action. And so this research really tries to shine a light on what's working really well in communities and what are some strategies that can be working even better. And so to kind of set the context for this whole report, unsheltered homelessness is one of the most visible and urgent challenges that's facing communities across our country. We chose to focus in on 4 counties in California because California is home to nearly 1/3 of the nation's homeless population, and nearly 2/3 of those folks are experiencing homelessness in a place not meant for human habitation. And so that's kind of the emerging issue. And in response, federal and state governments have made these unprecedented investments through things like California's Encampment Resolution Fund and HUD's Supplemental Notice of Funding Opportunity to meet the moment and respond to it and give communities targeted resources to respond to the encampments that they're seeing in ways that are humane, effective, and lead to permanent housing. So that's kind of the context that brings us into our research that we did.
Cool. Thanks, Will. And apologies if things are a little echoey. I saw that in the chat and I'm not sure what's going on, but hopefully folks can hear us. All right. So now that we have the context, I'm going to spend a quick second talking about the questions that we sought to answer and the methods that we use to answer them. So in this moment of urgent and unprecedented investment, of urgent need and unprecedented investment, we wanted to understand, as Will said, how communities were responding to unsheltered homelessness, what strategies they were using, and how these strategies were experienced by those who are most directly impacted by unsheltered homelessness, as well as these strategies. So we looked at 3 specific questions. First, we wanted to know what strategies communities were using to address homelessness in encampments and how they were addressing the needs of people living in encampments and how they were learning what these needs were. Next, we wanted to learn of these strategies, which were proving to be the most impactful for moving people from unsheltered situations outside into permanent housing. And finally, we wanted to know what barriers communities and residents faced or perceived to implementing these challenges. So if they weren't using these strategies or best practices successfully, why not? Next slide, please, Will. So to answer these questions, as has been said, we partnered with 4 California COCs. In Northern California, we partnered with Alameda, Contra Costa, and Santa Clara County, which are all in the Bay Area. In Southern California, we partnered with a little place called Los Angeles County. And over the course of the study, we began by doing a really thorough review of local policies and funding applications to understand sort of what was the intent, what was the original structure for how encampment response was going to be done. We then interviewed system leaders sort of before encampment closure, and then also after encampment closures. We talked to system leaders and service providers to understand this is what was intended, what actually happened, why, what changed, how did you pivot. We analyzed HMIS data. We did a really thorough review and synthesis of best practices and frameworks from other national organizations, including NAEH. And then most critically, we were able to interview many, many residents who were either currently living outside or had recently moved inside from being outside. And I do just want to take a moment to say these are people who we sometimes talk to multiple times on their journey, and they graciously shared their stories and their experience and their ideas of strategies that could work. And it's really our goal that these insights and this expertise is preserved in this study. And we're just so gracious for all of the generosity people gave with their knowledge and experience. Okay, so based off of all of that, we came up with a few qualitative findings, and I'm going to go over those quickly. So in the 100 plus interviews that we did, we didn't find that there was sort of like a one-size-fits-all formula, shocking to no one, I'm sure. But what we did find were some sort of best practices that continuously emerged in the research, and that we continuously heard from people within the system working in service provision, and also those who were living outside. And so we've kind of collected these into general themes and findings that I'll go over, and then I'm sure you'll hear more about from Josh and Kimberly, who are some of the people who actually put these into action. So our first theme is that clear, consistent communication builds trust. When we spoke to people who had experience living in encampments, one of the most consistent things that we heard was that they were interacting with many, many different people across many different organizations, and they were hearing just as many different things. So this could be everything from individuals sort of contradicting their own timelines on like a very micro level to inconsistent practices and messaging across organizations and departments. But the fundamental thing is that when policies and timelines and expectations are not aligned, it becomes extremely difficult for residents to understand what is happening, what their options are, what is expected of them, and for them to make decisions about their own lives. And so consistency in communication is really not just like an operational issue. It is really directly impacts trust, engagement, and people's ability to make informed decisions. And our next theme is pretty similar to this. Consistency and reliability among outreach staff to participants helps to alleviate fear and skepticism by building trust, which then motivates participation. So not only should everybody be on sort of the same page in terms of communication, but you should be trying to form relationships with people, honoring if there's an outreach worker and a resident who don't get along, and trying to find an alternative person who maybe does, and showing up as you would expect for people to show up for you in this situation. Next slide, please, Will. Thank you. All right. Residents value fairness and inclusion in housing selection. This one seems like pretty obvious, but this can happen in a lot of different ways, right? It can be transparency in how housing is being offered, in how by name lists are being put together, in how they're ordering people and that kind of thing. It can be giving residents an opportunity to visit the housing that they're being offered, or to see pictures of their actual room before they move there. Or it can just be as simple as like remembering and really honoring people's wants and needs. If somebody says XYZ is a non-negotiable, don't give them housing, don't offer them housing. That doesn't honor that. Theme 4 is about services. Services are just a really critical part of successfully getting folks into permanent housing. And this came up in a lot of different ways, from preparing people to be document ready should a space become available, to also like addressing employment or other potential barriers that might prevent them from staying stably housed once they get housing, to really beginning to form those trust and relationships at a like early nascent stage, right? Before there's even housing, to start to form those relationships that might help people who are service adverse or housing adverse to be able to wrap their head around moving inside. So because of this really critical nexus, reliable service access and coordination among providers and agencies is really critical to successfully housing people. Okay, now the next one, Will, thank you. Sorry. Okay, theme 5, I think, is really like the most important and central theme, and it's kind of what all of the other themes or findings we had come from, and that is that dignity, autonomy, and respect shape participation. Treat residents as adults, give them the trust and the dignity that you would expect to be given. I think like one disheartening thing that I heard a lot of stories about was people who had been told that such and such outreach worker or that this housing navigator would come and see them at X place at X time, and they needed to be there in order to get some service or some accommodation or housing or something. And people relied on that promise, and they missed appointments, and they didn't go to work, and they stayed by their tent all day, and the person never came. And then there was no apology, there was no explanation, there was just sort of like, sorry, we're doing it next Tuesday instead. And for that individual, they have now sacrificed, they've made sacrifices in reliance on this promise. The promise has been broken, they've been disrespected, there's been no acknowledgement, and they've further lost trust in the system potentially. So I think it's just very important to remember that when you're doing outreach, when you're going to encampments, you are working with people with full and complex lives now, like in this very moment. And if you truly want someone to move inside permanently, you need to understand the complexity and the color of that life. You need to honor it, and you need to listen to them and trust them and understand why they're outside and what they need to come inside. All right. 6th theme builds off of this, as I said it would, and that is that housing and programs should be designed for safety and comfort. Kind of like just considering whether the common spaces are places where you would want to spend time. Is there a place outside to take dogs that's not concrete or cement if you're allowing pets? To the extent possible, like ensure that rooms are comfortably and practically furnished. Do they have a table or a desk or a counter where residents can sit down to like write a letter or to sign a check? Is there a comfortable place to sit other than a bed? And then also just considering whether like house rules are necessary, or if there's like a less dogmatic or less severe alternative that could achieve the same results. So something we heard from a lot of people is that they wanted kitchens. People love to cook. They love the freedom and artistry and culture and socialization of cooking. And there are really good health and safety reasons for why there would maybe not be kitchens in individual rooms, but is there a way to allow people access to a group kitchen? Is there some way to contribute to the cooking of food or the designing of menus for residents, that kind of thing? And then finally, the 7th finding is that while interim housing is a really important step towards getting people inside, it's not sufficient in and of itself to keep them housed. They need consistent, individualized support to achieve stability and long-term success. And I think that is it.
Awesome. Thanks so much, Esther. And to really capture a lot of these kind of findings, our team put together, our colleague Shabani put together these comics that are in both the long PDF, but also on the website. So check those out to kind of get some character studies. So we just heard a lot about the qualitative findings from Esther, and now I'm going to dive into some of the quantitative findings from our research. So for the quantitative piece here, we really focused in on one city in one county, and that's Berkeley, which is within Alameda County, and 5 different encampments within Berkeley. And so to really study these and see how resident experiences differ, we studied HMIS data from 2021 to 2025, tracking 201 unique resident transitions from living in a specific encampment to moving to interim housing, permanent housing, or continued homelessness. And so to kind of paint a picture of the diversity of these encampments, they varied widely, and a lot of a lot of ways. Notably, the number of residents. So the largest encampment was Harrison Street, which had 75 residents, and the smallest was Old City Hall, which is 8. So you kind of imagine quite a difference in terms of the scale, and then the longevity as well. So People's Park, one of these encampments, has been an encampment on and off since the 80s, so 40 plus years as an encampment, whereas Old City Hall, when it was closed down, was just around for about 8 months. And this visual tries to get at the flow of people through encampments. So we see on the left people's home prior to their encampment experience. So the last city they called home before this episode of homelessness. And we see a large majority of them coming from the city of Berkeley itself, and the rest of them coming generally from the East Bay area. In the middle, we see the encampment or encampments they were a part of. So as can be expected, a lot of people were involved in multiple encampments, and so we tried to capture that here. And then finally on the right, we see their most recent exit. So as we finalized our quantitative research, what was the most recent exit that somebody had had? Were they continuing an encampment experience or a homeless experience? That would be at the top right. Were they in interim housing, waited for that permanent spot to open up? That's interim housing. And then had they made it all the way to permanent housing? And so really, we tried to evaluate each encampment and how they differed in terms of their outcomes. And so the outcomes for the residents are here. And probably the most relevant column is the one all the way on the right, which is percent to streets. And so you'd want this number to be as low as possible, meaning the percentage of encampment residents that exited to a continued experience of homelessness. You'd want that obviously to be as low as possible. And we see Second Street with the lowest, with just less than 1/3 of encampment residents experiencing that. And then Harrison Street being the highest at 57% of residents continuing to experience homelessness. And so really what we wanted to answer is why? Why did people in different encampments have different housing outcomes? And one idea that we came to was maybe the size of the encampment played a role. And so here we see the different encampment sizes, and then on the y-axis, the percent of residents exiting to the streets. So as a general takeaway, you could say that the larger encampments, so that the ones that had a higher number of residents, experienced less housing outcome success. So Old City Hall, right, that small encampment had generally good housing outcomes, whereas Harrison Street, which was the largest, had some of the least favorable. Also, how did outcomes vary by the number of years an encampment was active? And so we see a less, strong correlation here, but generally, especially for these first three on the left, as encampments become older, right? They're more entrenched, they've been around longer, it's more normalized in that space. It can be more challenging to connect those residents to housing outcomes, whether it's interim or permanent housing. And also, a major theme that we're hearing from the qualitative findings is that outreach is huge, and enrolling people in services is super important. And that was an outcome that we found in the quantitative research as well. So this is the average number of services each resident received within 180 days, so about 6 months of the encampment closing. And we see people that exited to permanent housing received 8.5 services on average, whereas people that continued their experience of homelessness received just 2.2 services. So that really begins to paint a picture that, if you can meet people where they're at, give them the services that they want to access, that it continues to build trust in the system. And that's another finding that we saw with program enrollment. So we wanted to see, does that same kind of connection apply to program enrollments as it did to services? And we saw that. We saw that people who exited to a housing outcome, so shelter or permanent housing, on average, those people were enrolled in 21, a little more than 21 programs. And these are programs of all types: street outreach, service-only programs, shelter, even day centers, things like that. Whereas people that did not exit to a housing outcome, right, they continued their bout of homelessness, they received less than half of that in terms of program enrollment. So strong connection there between enrolling people in programs and successful housing outcomes. So there's a lot more obviously in the full study, but in general, for our quantitative analysis, the main takeaways are to have dedicated interim housing for every encampment resident when you resolve the encampment. Work to resolve encampments as close to their inception as possible. Oftentimes when encampments become entrenched and they swell in size, they can be a lot more complex and challenging to resolve. and then begin outreach early and often to encampments as they start to form. Provide services that people really want and need, and outreach workers that can deliver them, and get them enrolled in programs. This can go a long way in building trust in the system and delivering on these small promises so that hopefully they can trust you when bigger ones come up.
Thanks, Will. All right. Brief conclusion. As we said, there is no one size fits all formula to successfully get people into permanent housing who have been living in encampments. But sort of what our big takeaway is that the feedback of people with lived experience should guide all facets of this work. And we have a couple of sort of takeaways for different folks, depending on your perspective. For policymakers, we would urge folks to prioritize and fund connections to housing rather than criminalization. To system leaders, connecting people to housing that they actually want, and that will just help programs to be that much more successful. For providers, focusing on building relationships and trust and responding in real time to the feedback that folks with who are currently experiencing homelessness are giving about the way things are working or are not. And researchers, just be really flexible about what you're doing. Probably all researchers know that, and to center the insights of people with lived experience. And if you want to get a hold of Will or I, our emails are there. I'm just Esther. He's Will Early. I don't know why he gets first and last, but he does. And yeah, if you want to stay in touch, Homebase has a newsletter that we would love if you would all sign up for. You can hit the QR code there and you'll go to our web, you'll be able to sign up for the newsletter and see our website, which has lots of other cool tools and resources. All right, thank you.
Thank you so much, Esther and Will, for that presentation of your findings. Really enlightening, really illuminating. My name's Alex Visosky. For those who don't know me, I work at the National Alliance to End Homelessness. I'm our senior California policy fellow. And one of the reasons we focus on California, right, is just because of the immense presence of unsheltered homelessness within our community. Our 2024 point in time count showed 124,000 people living unsheltered on a given night. As Will mentioned, that's about a third of the nation's unsheltered folks. And yet, as Will and Esther's research points to, we've seen a proliferation of really exciting new approaches to address unsheltered homelessness. And we're seeing that when we connect resources to those approaches, whether it's state, federal, or local funding, it's made a real difference. 2025 data statewide showed a 9% decrease in unsheltered homelessness, and individual communities are seeing real success. Our early numbers from 2026, as communities start to release their PIT count numbers, are showing sharp declines in unsheltered homelessness up and down the state. Communities like San Luis Obispo, San Diego, San Francisco. So I'm excited to kick off this panel with a couple folks doing boots on the ground work in some of these communities that are making headway. And so they're going to join us for a discussion on what the successful ingredients have been in their communities in addressing encampments. And then we'll do some Q&A from the audience as well. So keep those questions in the Q&A box coming. Will and Esther, if you should also feel welcome to type out any answers. There's some definitional questions in the Q&A too that might lend themselves to easy answers. So first I want to ask my brilliant colleagues to introduce themselves briefly. We've got Kimberly Barnett from the LA County Department of Homeless Services and Housing, somebody I've had the pleasure of learning from for many years. Kim, can you introduce yourself?
Everyone, thank you for making the time to join us today to discuss the great research that Homebase did with us. As Alex said, my name is Kim Barnett. I am with the county's Homeless Services and Housing. We are a new department, so I always get tongue-tied and I do it backwards. But I oversee countywide for LA County encampment resolution and coordination. And within that portfolio is our Pathway Home program, which is a very specific encampment resolution program.
Thanks, Kim. Pleasure to be joined by you today. We also have the pleasure of being joined by Josh Jacobs from the city of Berkeley. Josh, introduce yourself, please.
Hi, good morning, everyone. Josh Jacobs. I'm the Homeless Services Coordinator for the City of Berkeley. I'm in the City Manager's office, and I work on the homelessness response team. And that team also consists of 3 outreach workers who are out there doing the work, and we are also coordinating with the other outreach teams within the City of Berkeley.
Thanks, Josh. Good to have you here. Kim, first question for you. We heard from Esther and Will in their report about how street outreach staff are really vital in providing those services to folks in encampments. Can you talk a little more about LA County's Pathway Home initiative and what are some of the core services we see outreach staff offering as part of that initiative?
Yes, happy to do that. So Pathway Home is an encampment resolution program. It has several components in it. One of them is coordination and planning of an encampment, really learning the people that are there, what are some of the things that they're going to need, assessing their medical needs, their housing needs, what other things we need to address as we're planning for an encampment resolution. Then we have an actual operation date where we plan ahead of time and do some very specific messaging on what's going to be happening on the day of the resolution. We bring people into interim housing for Pathway Home, that is a motel room. We start to share where they're going to be going and what it's going to look like for them as they're entering the program. We also in there were able to fund and leverage intensive case management and a subsidy to ultimately exit to permanent housing. The services that our outreach teams provide, one of the things that we lean on is when we developed our coordinated entry system and our outreach coordination system to address unsheltered homelessness many years ago. Some folks I see on the call were part of developing that. We divided our services planning area in the county. It's divided by 8 regions. And as outreach teams were being developed, we learned and were able to know exactly where they were going to be deployed. So as we were planning for an operation, we ensured that we were leveraging the actual teams that had already existing relationships with the participant at some of these encampments, many which were legacy encampments, which means basically they've been there for a very long time. And outreach workers had already been working with those participants for a very long time. As we knew how many rooms were going to be available, we started to plan and design around the actual encampment and the people's needs, developing a by name list that had everything that we needed to plan for that particular person, including their pets, their medical needs, whether they needed an ADA unit, and anything else that we needed to be mindful of as our homeless neighbors were transitioning out of the encampment. Another thing that was beneficial is that many of these folks formed community within their encampment and they were going indoors with their own community that they already had built community with. And so, yeah, that's the secret sauce is outreach for us and leveraging those relationships that our outreach workers already had.
Thank you so much, Kim. I love that. Josh, same question to you. Tell us a little more about how this looks in Berkeley.
Sure, happy to. In Berkeley, we rely on a wide range of outreach providers that each bring a different lens to the work. Some teams are focusing on medical care, others are substance use treatment or housing navigation, benefits enrollment, basic needs. One thing that's been really important for us is not reinventing the wheel. We try to lean on the teams that already have relationships and build trust with the residents in the area and then build on that further to create some kind of warm handoff between more services and getting folks linked, kind of in the same way that Will's graph described. Like, we know that as you get progressive engagement, we're more likely to see positive outcomes. And so being able to build in the relationships that are already there has been really critical for us. Every week, we also bring providers together for case conferencing to talk through the residents who are most vulnerable and try to match people to any available resources that are there. And then also just have a space where providers can learn from one another and being able to kind of build from the lessons that they've already learned, or just the information they have about a specific resident in general, and being able to share that information with one another has been super critical. We know outreach work is super complicated. No, not one team has all the answers. So we're trying to, patchwork together everyone we can and learn from each other. I will say for the work that we do, a lot of it is a lot of early planning, trying to figure out and communicate directly with residents like, hey, we're planning to have an action here. These are the things you can expect. These are the things that you can look for and anticipate is going to happen, and try to be as transparent about that as possible. I will say that there are some difficulties with that. It's not always easy to be as transparent and not always possible. And I think just being direct about that as well is super important. Like we might not know how this is going to work or how it's going to operate at the moment. And so being upfront about that and saying, I don't know, is very important and critical. As we're trying to engage folks, we're trying to learn around what are their barriers? What are the things that you have been stopping you from taking a placement to a program, and really working with them to remove those barriers and try to get someone inside. I had a guy one time who was really concerned about his cat being able to get in and out of a window. And so we got him a little cat tree just to put up next to it. And that was able to get the cat in and out into the shelter. And that was the thing that got him to yes. And like it took 15 conversations with him to be able to get to that point, to realize that was the last thing that was really holding him back. But once we got there, we got there. So really just taking your time, having these conversations, not expecting the same solution to work for everyone, because it's not, and just, be patient.
Thank you, Josh. Yeah, appreciate that, and that focus on just meeting folks with really their individualized needs, whatever they may be. So Kim and Josh, we heard from Homebase, building off that, we heard from them about their 7 themes to what makes for high quality encampment engagement, things like clear and consistent communication, connections to permanent housing. What of the themes that they raised really stood out to you, and what have you learned, I think, from this report that maybe you can take forward? Yeah, either one of you, feel free to jump in first.
I can start. For me, the one that really stood out was the reliable service access and coordination. We can't rush these things. We have to be very, very, very careful on how we're planning things. We have to listen, right? We have to listen not just to our communities, not just to our stakeholders, but to our encampment residents and to our outreach workers as well. We can't be boots on the ground every day, but we can have a good relationship with the people that are, and listening and hearing what they have to say. Coordination for us has been just valuable, and I can't even express how many ways. When we're looking at things, we have to look at things a little bit higher up and seeing, we in LA County, we're very multi-jurisdictional, and different jurisdictions kind of plan things in different ways, even though they're one street away from a large encampment. And so we start seeing this whack-a-mole effect where you're just moving people around from one place to another. And so when we're looking at encampments, we're looking at a little bit broader location. We're using our HMIS. We have an encampment module in there. And so we're looking at different outreach points and touches where people are. So we could be very, so we can start to bring in the different partners that we need to coordinate, and hopefully able to align any operations that they may have had. For example, one of our very first operations, I was actually not at the county yet. I was at LASA. I used to work at LASA. And I remember that we were discussing this operation, this new thing, Pathway Home, and I was part of these calls, and I brought up that just down the street and just behind that, there was Caltrans areas that needed attention as well, and not too far down the street, there was another area. And if we were going to do this encampment here and not do the other 2 encampments nearby, we were going to have repopulation. And so they had different things that they were planning at different days, and bringing them together with a resource like an actual hotel room, an actual bed available for the people that were there. We were able to kind of stop, put a pause on it, bring all the different partners in, and align our cleanup dates so that we weren't displacing people from one place just to move into another place, and be very clear on how we were going to do the operation. And so encampment resolution and coordination is like one of the main things that we have to be mindful of. How do we coordinate? Who are we going to be talking to? Who do we need to bring? Who is missing from this conversation? And making sure that we're all aligning our ultimate goal, which is making sure that the people that are experiencing homelessness in those different encampments are able to have something tangible that they can go into, and that they know where they're going to be going to.
Thanks, Kim. Yeah, I appreciate you raising the time frame, right, that it takes. That I think we see encampment resolution used in a lot of different ways in communities around the country. Sometimes we see people say like, oh, 48 hours notice and then we're closing an encampment. That's not what we're talking about here, right? We're talking about really taking the time to understand people's needs and get them what they need. So thanks for raising that too. And the piece about the jurisdictional partners all needing to be at the table. Josh, yeah, any of the additional themes from the Homebase report that you want to lift up that really stood out?
I would say all of them, but I would really want to key in on reliability and follow through. I think it's so incredibly important in this work to be able to build trust. You need to be trustworthy, and you need to be able to build an ongoing dialogue with residents about what their concerns are, and then show that you can be responsible when it's feasible and direct and honest when it's not. People can tell when they're being managed versus when they're being genuinely engaged. When you're actually trying to like outreach to someone and actually like make a connection with someone, they feel that difference. And so being genuine in the way that you approach folks, being able to be reliable, being able to be trustworthy is so critical. I would say too, like many of the folks that we are encountering have, and I think we all know this, they've been in systems in and out of systems for a majority of their lives or some portion of their lives, and there's a lot of reasons not to trust someone from a system. And so you have to really, you're not just building a new relationship fresh, you're also repairing a relationship that's been broken. And so really coming to the work with that knowledge and that understanding makes a big difference. I also say one of the biggest lessons I've learned is that no encampment and no individual are exactly the same. I think we all know that as well, but I think it's really important. I think sometimes we think, oh, like this is the new hot thing. This is going to be something that's going to, be the magic bullet. It's going to cure this or fix this. And it really every different community is special and unique and has their own factors to be looked into. Yeah, you really need to be looking at all of the different histories, the needs, the strengths, the levels of trust within the system, different things that all of these different folks are coming into this come with, and then know that you can't just roll in expecting a one-size-fits-all solution to the work. You need to show up with a Swiss Army knife of resources and approaches, and then figure out which tool is the right fit for the right person at the time.
Thanks, Josh. One more question, then I'm gonna to you two, and then I'm gonna put some questions to Esther and Will. But Kim, one of the themes that came out in the report was the connections to permanent housing. Obviously, you've been a part of a lot of encampment work, sometimes with those permanent housing connections, sometimes without those permanent housing connections. Can you talk about what kind of difference that makes to have that permanent housing kind of in hand, and what it looks like when you have that versus when you don't?
Yeah, so let me share. Since inception, we've done 75 plus pathway home operations with 728 people out of 2,100 people that have been permanently housed. I don't think we would have been able to achieve that without the subsidy, that we were able to leverage some of the different funding sources that we have to make sure that those folks had that subsidy to move somewhere. And also the intensive case management, right? Because we need to have the support for those folks to be able to move in and finish their process. I think the good thing is that because we have a lack of permanent housing, outreach teams the thing that they can do for their clients outside of, being able to find permanent housing is to get them ready for that housing. And so we see that that happened a lot with our participants, is many of the outreach workers that had been working with participants in encampments that were being resolved had that history and had been working towards getting them housing. So they were working towards getting them housing ready, which for us is ID, social, disability verification. So having those things ready, and then having that subsidy that they were being able to be matched to, almost in some cases, not too long ago. Some people actually, we saw, already had vouchers or subsidies in hand that they had been matched to, but needed that extra support with housing navigation and intensive case management. I don't think without any of those services, we would have the numbers that we have of people being permanently housed. I think, as you all know, there's a lack of housing everywhere, but probably especially more in California. And so that number to me is exceptional, considering that there isn't very little housing in California, especially in LA County. And so having that extra subsidy or having those resources available, like folded into the actual budget that we had and the funding that we had available, really made a huge difference.
Thank you. Thank you for surfacing that. Esther, a question for you. Y'all bring up this idea that listening to encampment residents results in better design programs, right? So if I'm listening to this webinar, I'm a service provider, or I'm a COC lead, or I'm a city or county staffer, I might be wondering how do I go about learning from encampment response efforts in my area and figuring out what's working well, what's not. Are there some steps in this process that folks can replicate locally?
Yeah, Alex, thanks for that. Yeah, like I said, I mean, I think one of the things that really impressed me throughout this study is just how deep and nuanced of ideas and solutions people living in encampments have about how to resolve encampments, or how to interact with people living in encampments. And I think Josh said this, but people doing outreach also know a lot of those things, right? Like, these are conversations that are happening all the time. And often what needs to happen, like I think Kim was just saying, is just like this coordination, right? Like, there needs to be something from the collection of the information and then sort of closing the feedback loop. So we saw a lot of really good examples of that kind of throughout the process, many of them from the communities that are on this call, but like everything from sort of like designating a specific outreach worker who's really collecting the feedback and then bringing it to the appropriate channels, and then really, really importantly, bringing it back to residents and telling them what to expect. Even, as Josh said, if it is not what you think they want to hear, people would rather know, I did this and this, and we can't do anything right now, but it's been done, than, yeah, I'll pass it along, and then never be involved in closing that loop. I think like surveying people before encampments, there are all kinds of different ways to do it, but before encampment closures begin, about like what they need or what would want in order to be successfully housed, and trying to be responsive in the way that programs are designed. Holding community meetings with encampment residents and workers and city officials and things like that, so that there's an actual place for discourse and discussion about what's happening and what to expect. Having an advocate or liaison for an encampment, having a way for people to give feedback or to lodge complaints once they are in some kind of housing, especially if it's transitional or interim housing, that they feel will protect their identity and things, keeping it in some way anonymous, so that people feel comfortable disclosing their complaints. After people have been housed, do surveys again, see what's happening. And I think really, really importantly, and something I would have loved to have had the opportunity to do with this study, but whenever possible, if you can't successfully house someone, follow up with that. Interrogate that and try to understand why, and then just close the loops. I think that's just the most important part, and let residents know you've heard them and what the next steps are, even if there aren't really any.
Thank you so much, Esther. And Will, quick question for you. The numbers y'all have from this Berkeley case study, I think, are really powerful. Not every community is currently tracking encampment efforts in a way that allows them to do this type of analysis. What's your pitch to communities to do this? Like, what benefits does it bring?
Yeah, so this was a major reason Berkeley was such a great community to study for this is because they have a super strong way through this outreach module to connect people to encampments. So you can go on this live kind of map-based view of the city of Berkeley, and they've drawn a geofence around where the encampment actually is. And you click on that, and you can view all the residents. And it's a super powerful way to see, create a census of the people that actually are connected to a specific encampment, and then also to evaluate once an encampment is closed, how what worked and what didn't. And so that's like the number one thing if you're in HMIS and have any kind of sway in that world in your community is try to find a way to in HMIS connect people to specific encampments, whether that be through like an outreach or encampment module, which both Kim and Josh have in their communities, or if that's just not a reality for whatever reason, add it as like an enrollment question or like try to find some way to get that into the data because it really helps you evaluate what's working and what's not.
Thanks, Will. I think that's a powerful charge to folks working in community here. We have a lot of really excellent, thoughtful questions that people have been popping in the Q&A. So we're not going to be able to get to all of them, but I did want to put a couple of these out to our panelists, all four of you. One of these questions, wondering about messaging around the finding that encampments resolved early do better in terms of outcomes. How does that fit with the importance of allowing time to secure housing for everyone and meet the diverse needs of people rather than doing abrupt sweeps? In my community, sweeps are often justified by the claims that if you allow people to set up tents, they will be harder to house or become service resistant. So what do you say to that, to policymakers that are telling you, you know, hey, we got to do this quickly. We don't have, if you take too long, folks are just going to become entrenched there and won't want to leave. What's your response to that? And yeah, Kim, might want to jump
I
in.
can go. We have to, okay, so just straight up, we're at intersection of like government, communities, electeds, the people that we need to help, lots of feelings, lots of things that we have to navigate. And we have to bring, and now with proven encampment resolution, how we're doing things, and really have those hard conversations with those folks in those different, whether they're elected, whether it's a community, and explain what we see is actually working. Now we have proved many of those encampments that I talk about were legacy encampments that had been there for years, 10, 15 years. They have not re-encamped. And so we have examples that we can share with the people that want to just do go clean them up or go do a quick, a sweep. I hate that word. So time, we have the ability to share with folks what we're going to be doing in the time frame that we're asking. We also have to be mindful that there are a lot of large encampments near schools, near this, near that, and so being proactive in the work that we're doing, I think, is also helpful for us in practice. Being proactive with our outreach workers, knowing that the bigger, larger encampments are going to be something that we're going to have to address at some point, and so working earlier in advance of an actual operation, whether it's a scheduled cleanup or an unscheduled cleanup, we at least know who we have and who we need to plan for. The more time that we have and the more thoughtful we are and intentional in the outreach that we're doing and keeping all those people that I just mentioned informed of what we're doing, what progress are we making, and being transparent with the community. This is what we're dealing with. This is what we have. These are our challenges. These are our barriers, but we are working on it is usually, the approach that I would take in things of that nature. And then I can't say enough. planning ahead of time, being proactive as if we were going to resolve an encampment in advance, gives us the opportunity to start working on the things and the needs that people have at encampments.
Thank you, Kim.
We don't have to wait for an encampment resolution to start working with the people there.
Right. Esther, Will, you all looked at a bunch of communities. How much variability did you see in the quantitative data between regions or cities? Given that cities have different policies, right? What were the noticeable differences that you saw?
And you said quantitative. Are you qualitative? Because that would probably be a better lens to view it through, because there's more communities to compare, really.
I think I said quantitative, but the question actually says qualitative in the chat. So sorry.
No worries.
Reading is fundamental.
And hard, especially when you're on a live webinar. I mean, there was a lot of variability in what we saw from, you know, within regions and across cities, and even just different encampments in the same city. I think we do a much better job, because we have more space to do it, of really sort of describing some of that variability in the report itself. But yeah, I mean, like, I think that for the most part, regions that we saw that were doing this the most successfully and having the most positive outcomes were employing really different strategies depending on the individual, depending on the encampment across, you know, they had a really flexible way of approaching getting people into shelter. And yeah, I mean, it's hard to say. There were a lot of differences across regions and by cities and that kind of thing. You know, I mean, I think that, like, even within the same region, you saw some places that were doing a phenomenal job of building relationships, and that was super key. And then in a neighboring city, you would see that it was a different outreach worker every single time. And, you know, and there was just, there was a lot of variability that way. That we definitely go into deeper in the report. And I'm sorry, I don't have a better answer for that.
No, that is a helpful answer. And I think connecting to the last question I have for you all, which is, you know, for the focused encampment resolution, this is from the Q&A. For the focused encampment resolution efforts, did the research show stronger outcomes, right, when permanent housing destinations were identified or secured up front, compared with efforts that secured interim housing first and then relied on coordinated entry for pathways to permanent housing? And any of you should feel free to answer that, not just for Esther and Will, but like, yeah, anything you want to add there?
I mean, I will just say that I think we set out initially in this study to try to describe what the ideal pathways were for getting somebody from who was living outside into permanent housing. And the unfortunate reality we hit very early on is that there is just not enough permanent housing anywhere to be able to really identify those pathways. And so I would say we had the privilege of talking to some people who had been permanently housed. We learned really wonderful things from the half dozen or so that we talked to. But I would say, yeah, being able to have a pipeline, being able to set people up for permanent housing at the end of all of this is really pretty critical to getting them housed and to seeing through all of the themes that we identified fully.
Just to add to that,
go ahead, Josh. Yeah.
I think this is one thing that we haven't been able to implement yet in our community, but I would love to see it. Being able to prioritize through coordinated entry folks who are living in encampment as like a risk factor or an additional vulnerability, I think would be super valuable, and would be able to move quicker with some of these folks. Right now, folks are just ranked based on the questionnaires, at least in our community. I'm sure some other communities have differently, but just on the assessments that they're ranked in the system. And then there is no accountability for if you're sheltered versus unsheltered. And I think there's a lot of risk factors that go into how you're more vulnerable if you're unsheltered, that we should be thinking through more and trying to get folks into match to these housing resources that are available.
Thanks, Josh. Well, I want to thank all of our panelists for joining us today, but also just for the incredible work that you all are doing every day to, ensure that we're getting our most vulnerable neighbors connected to housing and services. So, thank you all so much. And if if everyone can just give them their flowers, we appreciate that. And then I'll pass the baton back to my colleague Nicole.
Thank you so much, Alex, and for all of our panelists and to everyone who joined us today. We really appreciate you taking an hour out of your day to learn with us. I would highly encourage everyone to check out Homebase's extensive materials. There are a lot of questions we weren't able to get to, but their report answers a lot of them. I just dropped all the links into the chat. The Alliance published a short summary of it as well, which is available on our website. I had to also take this opportunity to plug the Alliance's housing-focused street outreach framework, which offers a lot of practical guidance for designing street outreach programs that can effectively connect individuals and families experiencing homelessness to long-term housing solutions. So there's a framework on our website, as well as a webinar series we did last year that might be interesting to folks. And then last but not least, please do stay tuned for the next webinar in our Research into Action series. We'll have a great one on implementing PSH in rural areas coming up in the next few weeks. So with that, thank you so much again. Please do reach out to us at the Alliance or to the panelists if you have further questions about this work. Take care, everyone.
Thank you, everyone.